My name is Brandy Newell, and this is my presentation on HELLP Syndrome. What is HELLP Syndrome, you ask? Well, it is a severe hypertensive disorder that can occur during pregnancy. It is an acronym, and the H stands for hemolysis, EL stands for elevated liver enzymes, and LP stands for low platelets. Less than 1% of the population is affected. However, 10 to 20% of preeclampsia cases will suffer with HELLP syndrome. The women most likely at risk include being over the age of 25, Caucasian, obese, poor nutrition, minimal exercise, diabetic, no previous pregnancy, or preeclampsia. Symptoms include vision problems, severe headaches, seizures, neck pain, shoulder pain, chest tenderness, high blood pressure, nausea, vomiting, protein in one's urine, bleeding, fatigue, swelling, and or abdominal pain. Laboratory data indicative of HELLP syndrome include, first, hemolysis, which is noted by an abnormal peripheral smear, and elevated bilirubin of 1.2 or higher. Next, elevated liver enzymes, either AST or ALT, are twice the number of the upper limit, and the lactate dehydrogenase is 2 times the upper limit of normal. And lastly, platelet count is below 100,000. Treatment is symptom relief. IV magnesium can be used to prevent and or control seizures. Blood pressure is managed using blood pressure medication. Fetal heart tone should be monitored several times throughout the day. If severe anemia and or coagulation abnormalities are present, blood and blood products may be given. Decadron also has been shown to improve laboratory findings and reduce the length of time in the hospital. If the fetus is 34 weeks gestation or greater, or in cases with DIC, renal failure, placental abruption, or a fetus of non-reassuring status, prompt delivery is highly recommended. There are some varying opinions on how to manage it if less than 34 weeks gestation and stability is noted. The first opinion is to administer IM betamethasone twice daily to mature the fetal lungs and deliver 48 hours later. The second opinion recommends conservative management because of the increased risk of harm to the mother and the fetus. Maternal complications of HELLP syndrome include coagulopathy, placental abruption, acute renal failure, liver failure, and retinal detachment. Fetal complications of HELLP syndrome include stillbirth, intrauterine growth restriction, and risk of delivery before 37 weeks gestation. HELLP syndrome can be very mentally and physically traumatic for one to handle. Post-traumatic stress disorder is heightened at 4 to 10 times more likely. It is important as a provider to encourage the individual to get help immediately if they are feeling stress, anxiety, depression, or believe they may harm themselves. Thank you for watching my video, and I hope that you were able to learn about HELLP syndrome and the severity of this situation.